Hi, this is Dr. Bob Dannenhoffer. It's September 1st, and we're doing another one of our Facebook Live events. As always, I start off with a different mask each time. This is a mask that was made by one of the local people who sewed these masks. This is a very nice mask. It's got nice color, and they said it matches my shirt. But I'm going to take it down for those people who want to read lips. Again, Dr. Bob Dannenhoffer. This is Facebook Live on September 1st, 2020. This is a chance for you to ask questions, and so we ask you to put them in the chat section of Facebook Live, and we'll get to them. Now, we did have a... Oh, I'm sideways again. We're going to try and fix me. I've been sideways before.
Is that better?
Yeah, just hold it. So, and again, Dr. Bob Dannenhoffer here. This has happened once before, so we'll get started here. And so we'll do it. This is a chance for you to ask questions. Now, we did post a YouTube video on our Facebook page that got a tremendous number of watches, over 250,000, and we got some fairly nasty comments. So in the past, what we've asked people to do when they put it in a comment, tell us something that only somebody from Douglas County would know. Something like, Pete's Drive-In is the bomb, or Umpqua Ice Cream is great, or I really miss music on the half shell, something that only from Douglas County people would know. Now, if you're from out of area and want to comment, be kind, and we'll take your call. So we start off usually with a briefing, looking at the world, and then looking how we're doing in Douglas County, and then we'll take your questions. So we start off by looking at the world. The world has had 25 million cases, and we think we've probably missed as many cases as we've found. So lots and lots of cases of COVID-19. There have been 852,000 deaths, and the case rate in the world is steady but naggingly high. I mean, it just has stayed up there. We really thought in August and early September it would start to come down to a very low level, but it's stayed up there. It's still very active in India, Brazil, and really all of South and Central America. So South and Central America are really, really, really struggling with this disease. In addition, India is especially struggling with this disease. This started in Mumbai and has now moved to the other areas. Now, most times we think that you have a big city and then rural areas around it. Even the rural areas around Mumbai are still so much more densely populated than places in the United States. So we are really worried about this spread in India. We know that they're not doing nearly enough testing, so the number of cases must be enormous. And with having that high number of cases in India, it's going to make international travel really, really, really difficult. In the United States, we're at 6 million cases and about 187,000 deaths, suggesting that we'll hit 200,000 deaths by the end of September. California, Texas, and Florida are still active, although they're getting much better. But what we're seeing is a lot of outbreaks on college campuses. And so there have been big outbreaks around University of Alabama, University of North Carolina at Chapel Hill, University of Iowa, and pretty much everywhere where students have come back, we have seen many, many, many cases. And really talking about a lot of cases. So University at Alabama, 1,000 cases in a day, so that's a lot. We've also seen big outbreaks in South Dakota, North Dakota, and Iowa in the 2 weeks following the Sturgis motorcycle rally, likely related to that. Because if you look in South Dakota where it's been very active, it's in the areas where there are a lot of people. And so it's really, really problematic. So for example, in South Dakota, they've been having 200, 300, 400 cases in a day. They only have 880,000 people in the state. So that is a lot of cases every day. Oregon, we continue to add cases, but at a slower rate. We're now averaging between 150 and 250 cases a day, which is still way too high. We're seeing a lot of cases in Jackson County, Polk County, Jefferson County, and continue to struggle in Umatilla and Malheur County. Marion County, which is where Salem is, has really been problematic for many weeks now, and they continue to have lots of cases. The good news, Douglas County is doing so darn great. For 3 weeks now, we've had less than 10 cases a week, which puts us, or 10 cases per 100,000 per week, which puts us in the sweet spot for opening all schools. Now, to open schools, you need to have less than 10 cases per 100,000, probably the hardest metric, and we've met that. A less than 5% case positivity rate, we've met that for every week we've ever done this, and a less than 5% state positivity rate. And I think the state is getting there. I saw today is down to 4.4%. So I'm hoping that over the next 3 weeks, we're going to be able to open all of the schools. You know, if we took Douglas County as a state, and we're obviously not big enough to be a state, but if we did, we would have far and away the lowest attack rate at 1,600 per million. The other lowest state is Vermont with 2,600 per million, and far and away the lowest death rate. We've had 27 per million deaths. Hawaii has 44 per million. So Douglas County is doing very well. However, the cases we see are again associated with out-of-state travel and family gatherings. In fact, we had a death earlier this week that was also related to out-of-state travel and family gatherings. The other thing that we looked at this week is we looked at our first 20 cases or so and to see how they were doing. And I will tell you, I was shocked to see that only about 20% of the people are totally back to good. Almost everybody else continues to have symptoms. Shortness of breath, fatigue. Some people are short of breath enough that they continue on oxygen. A lot of people have had continued gastrointestinal symptoms. So anybody who suggests, this is just a cold, it's not. You have a cold, in 2 weeks you can barely remember you had it. These people are 4, 5, 6 months out, and they're still very ill. So this is clearly more than the average common cold. Okay, so I have some questions. So Virginia says, is it too early to get a flu shot? It is never too early to get a flu shot. So if you want to get a flu shot, that is great. The prime time to get it is 2 months before the flu arrives. Well, if you knew exactly when the flu has arrived, you'd make your appointment then. We don't know when it's going to arrive. Sometimes it arrives as early as November, which would mean that September is a good time to get it. Sometimes it doesn't arrive until later. But again, better to get it than to wait until the proper time and then miss your opportunity. So if you want to get a flu shot, get it. My grandkids did. Have there been any kids under 11 here with COVID? Yes, we had a 6-year-old who had COVID, got it from somebody in the family. She was moderately ill, but has since recovered. Yeah. So Zach says, can you address the rumor that CDC released info stating that only 6% of the deaths were COVID? I knew we were going to get this question. I really, really wanted this question. So the only people who should talk about this are people who've ever once in their life filled out a death certificate. And sadly, I have filled out maybe 100. And so the way you fill out a death certificate is you say the proximate cause of death and then the things related to it. So in pediatrics, most of the deaths we have seen are related to prematurity. And so we would say that this premature baby died of neonatal respiratory distress syndrome, might also have had liver failure, sometimes happens in babies, or kidney failure, and this is all secondary to prematurity. There's not a person in the world who would suggest that this baby didn't die because they were premature. And in that case, prematurity wouldn't be listed as the first cause, but prematurity most certainly caused the neonatal respiratory distress syndrome that killed this baby. What the CDC reported is that only 6% of the death certificates only had COVID. And I would suggest that is those 6% that were sloppily done. It's really hard to believe that somebody died simply of COVID and that they had nothing else. They didn't have respiratory distress, they didn't have pneumonia, they didn't have clotting, they didn't have something else. Because almost everybody who dies of COVID goes down this cascade where they start out with a little bit of a respiratory illness, but then wind up getting pneumonia, they wind up getting kidney disease, they wind up getting adult respiratory distress syndrome and dying. So Nick Cordero is a 41-year-old guy, and it brings a little tears to my eyes when I think about it. A 41-year-old young man, fabulous dancer, and he got COVID. He was in the ICU forever, it seemed, and finally died of COVID. So if I were to fill out his death certificate would say he had adult respiratory distress syndrome, which is the thing that ultimately killed him. He had adult respiratory distress syndrome. He lost a leg, so he would have had an infarct to his right leg and lost his leg. He lost his kidneys because his kidneys infarcted and he was in renal failure, and this was all due to COVID. So his death certificate would appropriately look like adult respiratory distress syndrome, infarct of the right leg resulting in amputation, kidney failure, all secondary to COVID. That is a death due to COVID. That's exactly how death certificates work. And people who have manipulated this data, this is especially egregious, because anybody who commented on this without talking to people about how death certificates are done should be ashamed of themselves, because this is a complicated thing. So Dr. Fauci spoke about this yesterday and today, and he said, no, don't believe that only 6% of deaths are really COVID. All of these deaths are due to COVID. In fact, there's really good data that there are other deaths that are probably due to COVID that haven't been counted early on because we didn't have tests, or now because people didn't get tested at the right time. If you look at the excess deaths in the U.S., there have been a lot of excess deaths. Many of these are probably due to COVID. So I know people tweeted about this. Most of those tweets have been removed because they were just so basically ridiculous. But again, there aren't there. There's a crisp $50 bill waiting for somebody whose death gets inappropriately called COVID. So I've seen people say that every death this year could be considered to be COVID, whether it is or not. That's not true. Or that if somebody has COVID months ago and then gets run over by a train, the death is going to be related to COVID. No. In fact, if you can find me one, I have a crisp $50 bill for the person who can show me in Oregon that has happened. So again, $50 is out there. So what percent have symptoms after recovery versus those who are not? So let's not talk about. So recovery is complicated because of the way we've defined it. When we've talked to people, there are some people who are asymptomatic, had no symptoms. Very few actually in our study. There are a lot of people who've had mild symptoms, never required hospitalization or whatever, but they're still pretty sick. So I talked to a young woman the other day who was diagnosed a few weeks ago. She said, I'm still feeling crappy. I wake up, I can do things for a few hours, and then I'm just so tired I need to go back to bed. So we don't know about the symptoms at 2 weeks, but still a lot of people are having symptoms. So Cheryl said, if I got a flu shot in March, when should I get one this year? Anytime. So basically the flu shots change a little bit each year, and so you do need to get a new flu shot each year. So as soon as you can get it, you should get it. All right, so we're going to have some other questions here. One of the questions is going to be about the vaccine. Some exciting stuff came out with the vaccine this week. The phase 3 trials are continuing. So phase 3 trials are trials where you do lots of people, all different ages, sometimes people with underlying conditions, people with a more diverse racial makeup than typically you do in phase 1 and 2 studies. And you look to see both, is the vaccine safe, and then is the vaccine effective. The good news is that there are no signals that this vaccine is not safe. And we should be starting to see those signals if indeed there's a safety issue associated with them. There's now been, at 30,000 people, some are out 2, 3, 4, 5 weeks. Clearly, if there are side effects, you should be starting to see them, and they'll continue to watch on this. So the first thing we know is it looks like it's probably going to be safe. The second is it effective? It's going to be hard to know. There are 2 ways to know if a vaccine is effective. One of those would be to watch the people who got the vaccine versus those who got the placebo and see over time what percent of each group developed the disease. So if a perfect vaccine, you could say we've found now that 1,000 people in each group were exposed. None of the people in the vaccine group got the disease, and all of the people in the placebo group got the vaccine. That would be a 100% effective vaccine, and would be truly remarkable because there are very few things that are 100% effective. So we'll start to see, and what we would like to see is we would like to see a difference between the 2 groups. They've said we need to have a difference of 50% in the groups. So let's say, 50 in one group, 25 in another group, a 50% difference to show that the vaccine is effective. Of course, that means not 100% effective. I don't think anybody is thinking that this vaccine would be 100% effective. But even 50% effectiveness would be good, because that would really slow the spread. And by slowing the spread, we could really get this disease under control. Yeah. So has a previous positive case been diagnosed again since recovery in Oregon? That's at 90 days. Sandy says, well, actually, the official definition of recovery in Oregon is 60 days. But the question is, have we seen repeat cases? There are now a couple of well-documented repeat cases, one in Europe and one in Hong Kong. These are people who had the disease months ago. They got better, and then had a positive test again. The person in Hong Kong was sick the first time and not the second. The person in Spain was sick both times. And what they were able to do in these two cases is actually find the genome for the virus. And the genome of the virus was different from the first to the second infection. So we really think this is reinfection. We've not seen any of those in Oregon. Now, I will tell you, in Oregon, not a place that we've done a lot of research, we don't really have the genome for many people who have the disease. So early on, people got diagnosed, they had a positive test, but we don't have the full genome of the germ. Now, up at the Knight Cancer Institute in Portland and in Seattle, they do have some of the genomes. So we'll certainly see if somebody who was diagnosed once with one genome can get sick again with another. Now, if the story is that everybody who got it the first time was sick and the second time wasn't sick, that would suggest that immunity worked. If, on the other hand, people were sick both times, that would suggest that immunity doesn't work and cast some doubt on the vaccine. So Zach says, what is the protocol for a parent who's been exposed to COVID and their child is in daycare? So if the adult has been exposed, and let's assume that the adult has been exposed outside of the household, so they were exposed, say, at work and then come back, the story is that that child is almost certainly a contact of the parent. If the child is a contact of the parent, that child should stay home from daycare or school or whatever for 2 weeks. Whether or not that child gets tested or not, really up to the child's doctor, but that child should stay home for 2 weeks. Nothing special needs to be done about the daycare. Okay, one of the things that has come up was about our little doppelganger YouTube video. That got a zillion, 250,000 views and lots of questions. And some really good questions, like, did we cherry pick the counties? No, we didn't, and we'll go through that analysis. Or are the counties so different that you couldn't compare them? I don't think so. I think the counties are, as I said, not identical twins, but more like doppelgangers. So a doppelganger is somebody who looks a lot like you, but is clearly not genetically related to you. They just happen to be somebody who looks a lot like you. Thank God I don't have very many of those. So let's see what else we got. One of the questions is about school reopening. Again, I've been working with the School Reopening Task Force, and it looks like in Douglas County we're going to be able to open K-3, we're going to be able to open special ed, we're going to be able to open up a career technical education, and we're going to be able to open up those schools that are remote and rural, things like Days Creek. And so we've already started doing it. So far we've not seen any problems, and that's our hope, because we've known in places where the background level of disease is low that schools can open and can open safely. So, for example, people say, are we going to have all these cases? Well, we've not had very many cases in kids K-3. In fact, we've had only one case in somebody who would be in grades K-3. And in that case, you'd have closed one class of one school. All the other classes in all the other schools would be going fine. So I think we can do it. Well, how does that compare to colleges, which have just this explosion of cases? Well, the difference is that kids who are in K-3 probably listen to their parents better than college students. Kids who are K-3 live with their parents but are not living with hundreds of others or going to keg parties. So we think that kids in K-3 especially are going to be safer. College is going to be very complicated because they're living in congregate settings, they're eating in congregate settings, they're doing things that college students do, going out, drinking, going to parties. I think college is going to be a real problem, but we'll see what happens. So Nancy says, do the number of people who are considered presumptive and tested negative get removed from the count? No. So people who are presumptive are people who were close contacts of somebody with the disease. This is not just anybody on the street. This is somebody who was a close contact of somebody with a confirmed case. That is, they had a positive test for it, they are a confirmed case, and you are a close contact. to give you the story, I've only had 2 close contacts in the last 3 weeks. So it's not like anybody who's seen me in the store or served me a bagel in the morning would be a close contact. You really have to have close contact less than 6 feet for more than 15 minutes to be a close contact. So, then very many. And so it's got to be a close contact, and then they have to have one of the 4 major symptoms: fever, cough, shortness of breath, or loss of sense of smell or taste. And so it's pretty hard to be a presumptive. Now, some of those people choose never to get tested. Their spouse had it, they figure they've had it. Getting a test doesn't help very much. Or they've had a test and tested negative. You got to draw the line somewhere, and considering people who are presumptive cases with a negative test as not having the disease is not how we do it for anything else. So we're doing it the way we do it for everything else. So again, the example that I've used a number of times: mom brings her 3 kids in with strep throat. They've all got fevers, they've all got swollen glands, they've all got big, nasty red throats. We would typically only test the first one and assume the other 2 had strep, probably the most logical thing. But if we did strep tests and 2 of the 3 came out positive and 1 was negative, I don't think anybody said, oh my God, we have no clue what that kid in the middle had. You'd assume they had strep. And similarly, that's what we do with COVID. We really got to get past this. Again, our number of presumptives is about 10% of our number of cases. It doesn't change anything. We really need to get past this. So Sonia says, would I risk working out in a gym? And I do. So I have my home little thing, and I do that every day. But then I go to the YMCA, and I use a mask or a face shield to do it, and I do it. I think it's perfectly safe. I think there was an outbreak in Australia associated with people who went to gyms, so I think we do need to worry about the heavy breathing and stuff that people do at gyms. But I think using a face covering or face shield, it is perfectly safe. Can you go back? Because I don't want to have a big contact with you. So we're going to go ahead and move the camera person here because I don't want to have any more contacts. All right, so a couple other things that came out this week. One is about this new rapid, cheap antigen test. So apparently the feds bought up 150 million of these rapid antigen tests. They're a little card here, and then you put a nasal swab, and apparently it works on itself. You don't need to do it in a lab. It's said to be relatively easy to do. Again, with all testing, these promises of all this stuff being available very soon, I'll believe it when I see it. If, however, we did have the tests that were easy to use, could be done at a school, could be done at a doctor's office, boy, that would be great. But again, we don't have it yet. The concern is with flu coming up. People are going to come up and get sick. They're going to have fever and cough like you have with the flu, or they're going to have fever and cough like you have with COVID, and it's going to be really, really, really hard to separate those. So getting some good testing would certainly be great. One of the other questions that came up this week was about effective treatments. Again, the only treatment which I think is out there which is really pretty effective is Decadron, a cheap and widely available steroid for people who've got moderately severe disease. I think that was shown in the Oxford study and had been shown in other experience to be very effective in decreasing the death rate in people who are quite sick with the disease. And I think we've seen that because I think we've seen that the number of people who are hospitalized and die, the percentage of that has been decreasing over time, suggesting that the Decadron is working. Remdesivir is also another one. Remdesivir is not as effective as we'd hoped. One study suggested that if you compare people who got 0 days of it, 5 days of it, or 10 days of it, the people who got 5 days did a little bit better than the other 2 groups, and the people who got 10 days of it did no better than the people who didn't get it at all. That's a little worrisome because usually what you expect to see in a result is that people who got 0 did the worst, people who got 5 days did a little bit better, people who got 10 days did the best. There's no reason there's no way to understand why people who got 10 days of it did worse. So Remdesivir probably does work, but it's not a home run. As I said, for people who like to do it's a bunt single. You'll never pass up a bunt single, but it's certainly not going to win very many ball games. Next one is convalescent plasma. Convalescent plasma got an emergency use authorization. Convalescent plasma has been widely studied, mostly by the Mayo Clinic. They have a lot of experience with this, and what they found is that it appears to be quite safe. So people who got convalescent plasma don't seem to have had any adverse effects from this, which is good because there are some adverse effects you can get from plasma, but people don't seem to have gotten any adverse effects from this. So I think it's safe. The question about whether it's effective is kind of up in the air. You know, if something works, you don't need to do 70,000 trials to know if it works, right? So any of us who've given a medicine that works, you know, by the third or fourth or fifth patient, you say, wow, this is really pretty great. So if we're now at 70,000 patients who've gotten it and we still can't tell whether it really helps that much, that's a little worrisome. There was one tiny subgroup analysis looking at people who got it early versus at a moderate time, and there was a little difference in outcomes there, but that's not strong enough to know if it really works. But since it's safe, doesn't seem to have a lot of side effects, it's probably okay to use. Am I dreading flu season this year? I dread flu season every year. And I dread because, you know, flu season is a bad disease. You know, flu makes a lot of people sick, causes a lot of school absence and work absence. And so it could be bad. Now, the good news is the flu season in the places on the other side of the earth that are now just getting through winter, typically when they have their worst flu season, have had a very mild flu season. Some have suggested that that very mild flu season is because wearing a mask, social distancing, staying home when you're sick is not only the best way to prevent COVID, it's also the best way to prevent flu. So it may be these other things that we're doing has allowed this to be a mild flu season. So I'm hoping that this is also a mild flu season in the U.S. That would be great. So Wink says, do seasonal workers that test positive count towards Douglas County even if they are not from here? So diseases get counted in the place where you consider your place of residence to be. So if I travel for a week to visit my mom in Virginia, and I'm really hoping I can do that at some point, and then come back and I get sick, I'm still a Douglas County resident. You know, if I'm in the military and I'm stationed in Florida, during the time I'm stationed in Florida, even though I'm from Douglas County, I'm a Florida resident. For seasonal workers, if they have a home of residence, that is a place that they call their home, they get counted in that area. And so we've had a number of our seasonal workers who tested positive who got counted in the area that they lived. However, if people are transient and don't have another address, you use the address of the place where they got tested. And so we've had a couple of those of people who did not have an address. They were truly seasonal migrant workers, and then it was hard to know where you would attribute it to. Do you attribute it to the last place they've been? Do you attribute it to the next place they'll be? If they don't have an address, and in that case, you attribute it to the place they were tested. So what is the face covering mandate? So there was a good thing done by OSHA last week, and the story is if you can maintain social distancing, either indoors or outdoors, then a mask can be taken down. If you cannot assure social distancing, either inside or outside, then you need to put your mask up. And so that's it. What about offices? Again, with offices, if you can maintain 6 feet of distance, then you can take your mask down. So I'd encourage you to look at this. It's an OSHA video that very nicely explains it. And that explains then why when the governor does a press conference, she takes her mask down. She takes her mask down. Or when I take my mask down, because I'm 6 feet away from other people, and being 6 feet away from other people, and stationary, I have social distancing. I can take my mask down. Now, if you want to wear your mask all the time, go for it. The question about how it's going to affect schools, I don't know. I had a bunch of long conversations today, and I'm not sure how the mask mandate fits in with schools. Okay, well, you know, it's 6:34. We've had a big, long day today. We are coming up on Labor Day weekend, and people ask what we should do with travel in Labor Day weekend. Again, remember the amount of disease in Douglas County is tiny. In fact, we think in the last 3 weeks, the number of people who have actually gotten the disease in Douglas County could be counted on 2 hands, so it's a very low number. Now, if you go to visit grandma in South Dakota or go to a family reunion in Iowa where there's 100 times more disease than there is in Douglas County, your chance of getting disease is 100 times more than getting it here. And then if you get it and bring it back, you can bring it back here to Douglas County. We are trying like crazy to get schools open. And the way to get schools open is to keep our rates low. If, however, we have 1 or 2 or 3 travel-related outbreaks for Labor Day, that is going to really screw it up because that's going to make, again, our schools not be able to open. And the stories are pretty amazing. There's a story that OHA put out earlier this week about a group that rented a beach house. Somebody was sick, everybody got it. They went back to work, exposed to other people, and they talked about hundreds of people being exposed and getting the disease from one ill-conceived beach house party. So be really, really careful about travel. We're so close. I'm just asking people to hold on for another couple of weeks for this. So Rena says, can you get a staph infection from wearing a mask? No. I mean, surgeons have worn masks for, since we've been doing surgery. And I don't know of a single time where doctors or nurses wearing masks in the operating room or other places have gotten a staph infection. Now, can you get staph infections? Absolutely. Staph really loves to grow in your nose. So if you had to pick all the areas in your bodies where you would find staph, your interior nares is the best place to find it. In fact, at a time we were really worried about methicillin-resistant Staph aureus, so MRSA, the best place to culture it from was a boil, if you could get a boil. But a lot of times you couldn't get a boil, and then what you need to do is just get the person's nose, and it was there. So your nose is a dirty place that carries lots of MRSA. So yeah, if you have MRSA in your nose, yes, you can get MRSA around your nose, but it's not really from the mask. Now, one of the things that I do notice, and I'm guilty of this too, that when I'm wearing a mask, I do tend to touch my mask more than I think I touch my face otherwise. So when I have this mask down, I'm sure people are counting the number of times I've touched my face during the videos. We've done, 50 of these, not very much when my mask is down, but when my mask is up, I think I touch more. So, you could possibly say I had the mask up, touched my nose a lot because I was touching that, and then got an infection, but it really wasn't because of the mask. It was because of touching your face. So for people who are prone to that, face shields are perfectly fine. Face shields have the advantage that there's a face shield there. You can't touch your face. And so, if you're worried about that, a face shield would be okay. Now, CDC is not big on face shields. And the reason they're not big on face shields is that there haven't been a lot of studies that show that face shields prevent me from giving it to other people. And there are a lot of sort of crazy little face shields out there. I see this little one that sits on your chin that is about the size of a Band-Aid. It's pretty hard to imagine that's going to prevent much disease. But because the CDC has not put out guidelines for that, they say you really can't trust face shields. And I would agree, if you're going to wear a minimalist face shield like that, it shouldn't be trusted. However, if you wear a face shield that covers your chin, goes to your forehead, goes to the sides of your face, that should be actually pretty good at preventing you from getting disease, preventing others from getting that. And it's really good at preventing you from touching your face. For kids in school, because kids in school are looking at the teacher to go ahead and make mouth sounds, they're looking at teachers to see what her looks are like, sit in your seat, we think that face shields are appropriate for use in schools. Okay, well that looks like it. It's another beautiful day in Douglas County. Thank you all for attending, and check on Facebook today or tomorrow. We'll put up our doppelganger too. It's pretty interesting analysis of different counties and how they fared. Again, Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. Thanks.